New drugs have been designed to affect that interaction between policeman, immune system, and cancer cell bad guy.
Every day, millions of people hear the word radiation and immediately feel fear. It sounds invisible, powerful, dangerous. But what if you truly understood what radiation therapy actually does inside the body? Not in a frightening way, but in a scientific and calm way. Radiation therapy is one of the most widely used and carefully studied cancer treatments in modern medicine. It has helped save lives for over a century, and today it is more precise, more controlled, and more personalized than ever before. In this video, we will gently and clearly explain how radiation therapy affects cancer cells and why healthy cells are affected differently. No fear, no exaggeration. Just real science, explained simply, so patients and families can understand what is happening inside the body. What radiation therapy really is. Radiation therapy is a medical treatment that uses high-energy radiation to damage the DNA inside cells. DNA is the instruction manual that tells cells how to grow, divide, and function. Cancer cells grow and divide much faster than normal cells. Because of this, they are more vulnerable to radiation damage. When radiation damages a cancer cell's DNA beyond repair, that cell can no longer survive or reproduce. Radiation therapy is not a single treatment. It is actually a group of techniques designed to deliver controlled doses of energy to specific areas of the body, with the goal of destroying cancer cells while protecting as much healthy tissue as possible. Today, radiation therapy is used in about half of all cancer patients at some point during their treatment, either alone or combined with surgery or chemotherapy. Why cancer cells are more sensitive to radiation? To understand why radiation works, we need to understand how cancer cells behave. Normal cells follow strict rules. They grow, divide, repair damage, and die when necessary. Cancer cells, however, lose this control. They divide rapidly, ignore repair signals, and continue growing even when damaged. Radiation targets this weakness. When radiation passes through a cell, it creates tiny breaks in the DNA. Healthy cells usually detect this damage and activate repair systems. Cancer cells, however, often have faulty repair mechanisms, meaning they cannot fix the damage effectively. As a result, radiation causes cancer cells to stop dividing, lose their ability to survive, die naturally over time. This process does not happen instantly. Cancer cells often die days or weeks after radiation, which is why tumors may shrink gradually rather than immediately. How radiation is delivered to the body. Radiation therapy can be delivered in different ways depending on the type, size, and location of the cancer. The most common method is external beam radiation therapy, where a machine directs radiation beams toward the tumor from outside the body. These beams are carefully shaped and aimed to match the tumor's size and position. Advanced imaging, such as CT and MRI scans, allows doctors to map the tumor precisely before treatment begins. This planning ensures that radiation reaches the cancer while limiting exposure to nearby healthy tissues. Other forms of radiation therapy include brachytherapy, where a radiation source is placed inside or near the tumor, proton therapy, which uses charged particles that stop at the tumor site, reducing damage beyond it. Each method is selected based on scientific evidence and the patient's individual situation. Why healthy cells are affected. 2. A common question patients ask is, if radiation targets cancer cells, why does it also affect healthy cells? The answer lies in how radiation interacts with all living tissue. Radiation cannot distinguish between cancer cells and healthy cells on its own. It affects any cell in its path. However, the key difference is how those cells respond afterward. Healthy cells are generally slower to divide, better at repairing DNA damage, more capable of recovery. Because of this, most healthy cells repair themselves over time after radiation exposure. This is why side effects are often temporary and improve after treatment ends. Doctors carefully plan treatment schedules to give healthy cells time to heal between sessions. Why radiation is given in small daily doses. Radiation therapy is rarely given all at once. Instead, it is delivered in small daily doses, usually over several weeks. This approach is called fractionation. Fractionation is used because cancer cells accumulate damage with each dose. Healthy cells repair themselves between treatments. The overall effectiveness is increased while reducing harm. This balance allows doctors to deliver enough radiation to control or destroy the cancer, while minimizing long-term damage to normal tissues. This method is one of the reasons radiation therapy has become safer and more effective over time. How radiation therapy affects tumors. Over time, radiation does not usually make tumors disappear overnight. Instead, what happens is, cancer cells stop dividing. The immune system clears damaged cells. The tumor slowly shrinks. In some cases, radiation does not eliminate every cancer cell, but it prevents further growth, turning cancer into a controlled condition rather than an aggressive disease. The response to radiation varies depending on cancer-type tumor size, genetic characteristics of the tumor, overall patient health. This is why treatment plans are personalized and adjusted as needed. Side effects, why they happen and why they are often temporary. Side effects from radiation therapy occur because some healthy cells are affected along with cancer cells. The most common side effects depend on the area being treated. For example, radiation to the skin may cause redness or irritation. Radiation to the digestive system may cause nausea or changes in appetite. Radiation to the breast area may cause fatigue. These effects are usually localized, meaning they occur only in the treated area. Importantly, many side effects improve after treatment ends because healthy cells regenerate and recover. Doctors continuously monitor patients during treatment to manage side effects and adjust therapy if needed. Why modern radiation? Therapy is safer than ever. Radiation therapy today is very different from what it was decades ago. Modern advances include 3D treatment planning, image-guided radiation therapy, intensity modulated radiation therapy, IMRT, proton therapy. These technologies allow doctors to shape radiation beams precisely, adjust intensity within the tumor, reduce exposure to surrounding organs. As a result, patients experience better outcomes and fewer long-term complications than in the past. Radiation therapy and the immune system. Recent research shows that radiation does more than damage cancer cells directly. It can also activate the immune system. When cancer cells are damaged by radiation, they release signals that alert immune cells. This helps the body recognize cancer as a threat. In some cases, radiation is combined with immunotherapy to enhance this effect, allowing the immune system to attack cancer more effectively. This combination is an exciting area of ongoing research and represents a promising future direction in cancer care. Radiation therapy in breast cancer, important focus. Breast cancer is one of the most common cancers worldwide, especially among women. Radiation therapy plays a major role in breast cancer treatment. After surgery, radiation is often used to destroy remaining cancer cells, reduce the risk of recurrence, protect surrounding healthy tissue. Studies show that radiation therapy after breast-conserving surgery significantly lowers the chance of cancer returning in the treated breast. Modern breast radiation techniques are designed to limit exposure to the heart and lungs, reduce long-term risks, preserve quality of life. This is a strong example of how science and precision work together to improve outcomes. Integrative care and supporting the whole patient cancer treatment is not only about destroying cancer cells, it is also about supporting the person. Many treatment centers now use an integrative approach that combines radiation therapy with nutritional support, physical activity guidance, stress reduction techniques, mental health care. Managing fatigue, anxiety, and emotional stress is just as important as managing the tumor itself. Scientific evidence shows that patients who feel supported physically and emotionally often tolerate treatment better and maintain a higher quality of life. Why knowledge reduces fear? Fear often comes from the unknown. When patients understand what radiation therapy is, how it works, why side effects happen, how recovery occurs, they feel more empowered and less overwhelmed. Education does not remove challenges, but it restores a sense of control, which is deeply important during cancer treatment. Hope through precision medicine. One of the most encouraging developments in cancer care is precision medicine. Doctors can now analyze tumors at a molecular level to predict how they will respond to radiation, adjust dose and timing, combine therapies more effectively. This means treatment is becoming more personalized, more accurate, and more humane. Radiation therapy is no longer a blunt tool. It is a carefully guided medical strategy based on decades of research and continuous improvement. Radiation therapy is not about harming the body. It is about using science to restore balance where disease has taken control. By targeting cancer cells while allowing healthy cells to recover, radiation therapy remains one of the most powerful tools in modern oncology. Understanding how it works replaces fear with clarity, and clarity leads to confidence, hope, and informed decision-making. If you found this explanation helpful, educational, or reassuring, please subscribe to the channel. Here, we focus on science-based cancer education, clear explanations without fear, real expert insights, calm, supportive content for patients and families. Your support helps us continue creating trustworthy content that empowers people with knowledge.